Hello, my name is Preston, and this is my Capstone project. This presentation will be on the use of heated and humidified high-flow nasal cannula oxygen administration in pediatric respiratory distress. So some background on myself. I am a pediatric emergency and trauma nurse. I use high-flow nasal cannula oxygen on a day-to-day basis. It was not something that I was familiar with prior to starting in the pediatric emergency room. So I felt like this was an interesting topic to both further my knowledge base as well as bring to the table for some people who may not have ever seen this before. So this project will have an overview of the high-flow nasal cannula system, go over some brief physiology, and as well as some clinical indications and efficacy. So heated and humidified high-flow nasal cannula oxygen administration is rapidly becoming a preferred treatment for patients in respiratory distress and sometimes in respiratory failure. It's definitely seeing a significant increase in use in the pediatric population, and that's primarily because it's an excellent method for avoiding the use of invasive airway management. It prevents us from having to intubate a lot of kids. How does it work? This is a nice little mnemonic from Rebel EM. If any of you are involved with emergency medicine, whether it be pediatric, adult, transport, hospital-based, this is an excellent resource. So the mnemonic is high flow. So the H stands for heated and humidified. So it provides a heated and humidified gas. Inspiratory demands can better meet elevated peak inspiratory flow demands. Functional residual capacity, so this increases FRC, most likely through PEEP. And lighter, it's more tolerable than CPAP or BiPAP, so that's going to increase the compliance with it. And then oxygen dilution, and then washout, dead space. So we'll go over a couple of those things here in just a few moments. So how does this work? Provides a heated and humidified oxygen through a nasal cannula. It heats the oxygen between 34 and 37 degrees Celsius and can provide up to 100% humidity. The FiO2 is adjustable. It can deliver up to 100% FiO2 and delivers at high flow rates. Hence why it is called high flow. It can deliver up to 60 liters per minute. Two main companies produce the high flow machines. It's going to be Vapotherm and Fisher-Paykel. Vapotherm is going to deliver up to 50 liters per minute, and then Fisher-Paykel has two units, OptiFlow and Airvo 2. And Airvo 2 is usually the one that I see in use frequently. Both of these units actually deliver up to 60 liters per minute. So here are just some examples of the high-flow nasal cannula systems as the OptiFlow and the Vapotherm. The Airvo 2 is pretty similar to the OptiFlow. So, some patho key terms. Tidal volume is going to be the volume of air that enters and exits the lungs. Positive pressure is when pressure is inside is greater than the pressure outside. Positive end expiratory pressure, or PEEP. This is a positive pressure remaining at the end of exhalation. Dead space, and that is the volume of ventilated air that does not participate in gas exchange. So when we're talking about dead space, it's usually the pharyngeal area. Basically, you have when you breathe in, and then when you go to, you are rebreathing about a third of the air that you had previously breathed out. So you're actually you're breathing in more of that exhaled CO2 than you may realize. So we'll get back to that here in just a few moments. But everybody's favorite gas laws. This was something that our chemistry teachers tried to drill on our heads, both in high school and in college, but none of us really wanted to listen because who cared at that point in time? But gas laws are really important in relation to ventilation, obviously, because there is a gas exchange. One of the most important gas laws involved in ventilation is going to be Boyle's law. So this is when the pressure of a gas increases as the volume of the container decreases. You may think, well, how does this relate? Well, oxygen, CO2, they're in gaseous form, and your lungs are going to be the container. So ventilation is the movement, the volume of air that is moved in and out of the airways. And then the difference between the atmospheric, so the air outside, the intrapleural, inside the lungs, and the intraalveolar, inside the alveoli, pressures results in the gas exchange. So the differences in pressures actually causes the shift in molecules. We won't get too deep into that. It's a whole nother rabbit hole. And then kind of reverting back to the Boyle's law, just remember pressure gas increases as the volume of the container decreases. So thinking about your lungs as the container, as the muscles in your thoracic cavity expand, and your diaphragm and all the other muscles involved, as they expand, the lung volume increases, your lungs expand. Then pressure inside the lung. Remember Boyle's law, pressure of gas increases as volume decreases. So as volume increases, pressure decreases. So the pressure in your lungs decrease comparatively to the atmospheric pressure. So this is what actually allows air from the atmosphere to come in. Air travels into the lungs. This now increases the pressure in the lungs. As the muscles in your thoracic cavity, diaphragm, all that contract, air is squeezed out of the lungs because now you are making that container smaller. So this is forcing out air so that you exhale. And then it increases the pressure inside the lungs because the volume decreases. Heat and humidification. Most of us in the emergency side of things, we don't see patients very long. They either we get them stable and we get them up to the floor, or get them discharged. So from a standpoint of, if I put someone on 2 liters nasal cannula, if they're on it for an hour, is it the utmost priority that they get put on humidification? Probably not, but should they? Maybe. Thinking about the use of high flow nasal cannula or even long-term oxygen administration, that's when you're really going to see the effects of humidification. So standard oxygen delivery systems are not usually heated or humidified. Non-humidified air can actually lead to airway inflammation, which if you're having a gas exchange problem or you're having a problem with your airway, it's just going to make it worse. Big words here. So impaired mucociliary function. So inside your respiratory tract, you have these little, how do I describe it? They are like little tails almost in the respiratory tract. And what they do is they actually have this movement that it's kind of like a conveyor belt that gets mucus out of the lower respiratory tract up to the upper respiratory tract, so you can cough it out and expectorate the mucus. So now this function becomes impaired, which then creates further problems for your airway. Also, non-humidified air can lead to an increase in caloric expenditure related to both gas exchange and respirations. Cool air leads to the drying out of the mucous membranes within the airway, which are going to cause further problems. So adding heat and humidification to this assists in preventing the airways from drying out, as well as causing the problems with the mucociliary function, as well as increased caloric expenditure. Which, kind of going back to that, if you think about it, if your patient's in respiratory distress, they're already using up a lot of energy. So using up energy, and then now we're using up more energy, your patient is going to start to decline until now they are in respiratory failure and then eventually respiratory arrest. So obviously we want to avoid that. Washout. So going back to dead space, again, when we breathe in and then when we breathe out, there is about a third of the expired tidal volume that is rebreathed. So if you're rebreathing it, you are breathing in mostly CO2. Respiratory failure actually leads to an increase in dead space because it is impairing your ventilation. So you are not going to be breathing as effectively. So it's going to increase your dead space, which means you are now breathing in even more CO2. So what high flow nasal cannula does is it actually forces a higher concentration of oxygen into the airways. And then it causes that higher concentration, higher pressure, and higher flow causes that dead space to essentially wash out. So all of that CO2 is now breathed out. It decreases the amount of CO2 that is rebreathed, as well as increasing the available oxygen that is present for gas exchange. This is just another version of the high flow nasal cannula setup. So some clinical indications for use. When I saw that studies were kind of lacking, I was a little bit surprised. But the deeper I delved into it, the more I realized that high flow nasal cannula is actually a relatively new treatment modality. So once I learned that, it was not as surprising. It was just, it caught me a little off guard because of how much I use it on a day-to-day basis. Current studies are showing that high flow nasal cannula is effective. However, in some patients, it may be better to use other non-invasive measures like helmet CPAP. And usually, from what I read, those patients were usually a little bit younger, like your neonates and your infants. But this appears to be most beneficial to your patients who are dealing with acute bronchiolitis. So in your pediatric patients, it's usually RSV, your acute respiratory distress patients, and your asthmatics. The guidelines that were used for this were from Dayton's Children's Hospital. So infants with respiratory distress that do not respond to conventional therapy and require greater than 1 liter per minute if they're under the age of 4 months, or greater than 1.5 liter per minute if they are over the age of 4 months. Patients who are exhibiting signs of respiratory failure should not be considered for high flow nasal cannula, according to the Dayton's Children's Hospital. So that wraps up this presentation on HFNC. Hopefully it was informative for you guys, as informative as it was for me. Someone who uses this daily. I learned a lot by doing this presentation. If you guys have any questions, please let me know. There will be a brief quiz at the end to assess your knowledge that you gained from this, as well as assess your thoughts on the presentation. Thank you.